next speaker is Dr. Natalie Johnson from the Texas A&M School of Public Health, and she'll discuss the public health impacts of air pollution. Dr. Johnson is an associate professor at Texas A&M, and through her work, she assesses individual and community-level exposure to air pollutants. She directs mobile monitoring responses during disasters, and her team is investigating the effects of prenatal and pediatric exposures to air pollution and the long-term effects on pulmonary immune development and respiratory disease risk. Please help me welcome Dr. Natalie Johnson.
All right, thank you so much for having me. I really appreciate the invitations from the organizers. And Dr. Flowers, that was a perfect kind of primer into moving into now talking about the health effects of some of these pollutants. So with full disclosure, I added in toxicology into the title because that's my wheelhouse. And I'm really thinking about risk of health effects as a function of both the hazard of the pollutant and the exposure. And we know that now it's not just about what you're exposed to, but really dictated by where you're living, and that's going to dictate exposure. And risk will also be dictated about when you're exposed, so sort of these susceptible windows of time, young and old. And I'll show some data today coming from the lab looking at kind of both of those aspects. So just kind of big picture, these are data from the Health Effects Institute State of the Global Air, showing that in 2021, globally, over 8 million deaths were due to air pollution. And that actually ranks second, just after high blood pressure, as a risk factor for death. And in fact, many studies show that air pollution can increase blood pressure as well. And so this makes up a large swath of disease, especially chronic obstructive pulmonary disease, heart disease, stroke, and lung cancer. And when we do kind of look across age, you do see these distinct categories. So these data, again, from that same report, are showing the burden of mortality by pollutants. So orange is the household air pollution, which is largely gas phase and particulate matter, and then blue looking at that fine particulate matter, and then yellow for ozone. And you see kind of later in life, a lot of that mortality is driven by the cardiopulmonary effects, but there's also this window early in life, in those first year, and then really kind of first 4 years of life, where air pollution is actually, again, second for global risk factor of death for children under the age of 5. And a lot of this is driven by its impact on preterm birth, so kind of often very preterm birth, very low infant birth weight, which can lead to complications early in life, and lower respiratory infections that often can result in death. But it's not just about mortality, it's also about morbidity. And a number of studies, both from the observational kind of environmental epidemiology literature and basic toxicology studies, have shown a large weight of evidence with association between PM2.5 and adverse effects on neurodevelopment, increasing studies on impact on metabolic health and risk for metabolic diseases like type 2 diabetes, and also respiratory diseases, namely asthma. And this kind of goes right alongside with ground level ozone and PM2.5, both with this ability to exacerbate existing asthma. So those would be susceptible groups for those kind of poor air quality days, and kind of all the associated symptoms related to asthma. And unfortunately, even though I think there's been large movement and improvement in air quality, as Dr. Flowers just showed, if you are to look on the American Lung Association, the state of their air, they rank the top 25 most polluted cities. And unfortunately, Houston, and grouped with kind of Pasadena, is showing in the top 10 for a lot driven by ozone, and then also annual particulate pollution. So the question that my lab really wanted to focus on when I began a research group at A&M about 12 years ago is how does early life exposure to PM really cause asthma? So there's a lot of studies, again, showing exacerbation. And in observational studies, it's known that moms that live close to heavily trafficked freeways, so a lot of traffic-related air pollution, are more likely to have children that will eventually develop asthma. So we really wanted to try and tackle this question. And we wanted to tease apart Was this effect really more indirect? So as early as pregnancy, moms that are carrying the baby, and as those lungs are developing, is it caused through kind of this maternal oxidative stress and inflammation process, which would give opportunities for maybe improving maternal and child care in that prenatal period? Or was there also a potential for direct impact on the placenta? And so one thing that I'll bring up is our research on ultra-fine particles. And these are particles that are less than 100 nanometers. And one of the kind of first studies showed in 2019 that these ambient black carbon nanoparticles could potentially reach the fetal side, meaning that they could directly cross the placenta and get into fetal circulation. I'm working really closely with Dr. Rennie Zhang. He's an atmospheric scientist at Texas A&M, and these are some data from one of his air quality studies looking at, on the top, you can see actually in that dark black line, the mass concentration of PM 2.5 growing. And so this is actually a large kind of air pollution event. So here, you've got nice clean skies, and then you're actually building to a large pollution event, and these were data that were collected in China. And you can see those pollutants are composed of a lot of secondary organic aerosols, including organics, nitrates, sulfates, ammonium, and chloride, and also some black carbon. But what you see here on the bottom is actually when the PM 2.5 mass concentration is low, you have a huge number of tiny particles. So those particles are really small, so they don't have much mass, but they're there in large numbers. And some of the continued research that we've been doing on campus kind of during heat waves is we're seeing similar things, even in a place like College Station where the dominant VOCs are biogenic by nature, isoprene coming from oak trees. We're actually seeing a lot of ultrafine particle formation, kind of this new particle formation during these heat waves, and when you also have high levels of ozone. So what I first did as a toxicologist is said, as opposed to waiting many, many years for studying this in a human population, which I think is very valuable, could I start to get some mechanistic information from using an experimental model? So what we did together is we created a particle composition that would kind of mimic what would be representative of kind of PM, including those sulfates, nitrates, some diesel exhaust PM, and chloride. And we generated particles to use in animal exposure chambers with a mean diameter of 50 nanometers. And we aimed for a concentration. I should say ultrafine particles do not have any sort of regulatory value right now. So they're not regulated, and they're not commonly measured either because they are a little bit more difficult to measure. But what we did is we went with generating particles concentrations of around 100 micrograms per cubic meter within these chambers. And when our mice would go into the chambers during pregnancy for 6 hours a day, that actually equated to a cumulative dose of 25 micrograms for a 24-hour period, which was what the previous WHO guideline was for the 24-hour recommendation. This was our first study design. We actually exposed 2 different strains of mice, and this was to get at kind of, different genetic backgrounds, because asthma definitely has a genetic component as well and has that gene-environment interaction. So we used a bulb C mouse, which is kind of a characteristic Th2 asthmatic type responder. And then we also use a C57 mouse, really commonly used in experimental studies and known to be sensitive to oxidative stress. We time-mated these animals, exposed them throughout the gestational period. For mice, that's about 18 days. And then once the offspring were born, we sensitized and challenged them with a very common allergen, house dust mite, and looked at the airway responses. And what we see here, these are cross-sectional images of the histopathology, and this is what you want to see in a lung. A lot of white space is good, meaning that the airways don't have any kind of immune cells infiltrating inside. And with the ultrafine particles that are just challenged with a saline control, you really don't see a lot of impact of inflammation in these offspring without any sort of subsequent allergen challenge. Now, when we challenge those animals with house dust mite, what you see here on top is around the airway, so kind of around the bronchioles, you have a ton of influx of eosinophils. And that's a really common immune cell that's associated with asthma. And here, what we actually were really surprised to see is with the prenatal exposure to ultrafine particles, we had a suppressed response. So we kind of started, and this is science, we were scratching our heads saying, okay, why are we getting this sort of, suppressed immune response following this early life exposure? And we saw it was most pronounced in the C57 Black 6 strain. So we looked at a couple of important pro-inflammatory cytokines, which are actually sending out the messengers to recruit those eosinophils into the airways. And what you see here is with this first group in red, this is the ultrafine particles, or this is actually the filtered air with the house dust mite. You get a large response in both IL-13 and IL-17. And then when we had the kind of exposure with the ultrafine particles in house dust mite, we saw a suppression. So what we actually uncovered in this specific model is that the early life exposure to those ultrafine particles actually caused a delayed differentiation of the T cells. And the T cells are the ones that actually send out those IL-13, IL-17. So, we weren't picking up an asthmatic response, but when we followed up with some of this work subsequently in the lab, we saw this was actually a huge risk for early infant infection. So again, these are all the graduate students featured that are actually in the lab doing this work. And Carmen Lau was a talented graduate student, a DVM pathology resident as well, that went on to show when you were to expose these mice prenatally to ultrafine particles, they actually had a much more severe infection following infection respiratory syncytial virus, or RSV, which is a really common cause of childhood hospitalization. An RSV infection on its own is a substantial risk factor for asthma later in life. So this could also be another mechanism of why exposure to air pollution could increase the risk for lower infant respiratory infections that could then have a later in life risk for asthma. Also, through some collaborative work in Stéphane Cormier's lab, who's a professor at LSU, she showed when you actually wait until these mice are out to 12 weeks of age and you re-challenge with an allergen, they have a much more severe response. So it's very likely that there's just a delay in the immune cell maturation, and then that delay may cause an increased susceptibility to early viral infection, but a switching later in life to get more of an asthmatic-like phenotype. We also did some additional kind of mechanistic study where we looked at the role of the factor known as NRF2. NRF2 is sort of this master transcription factor associated with antioxidant response, and it actually can protect against altered pulmonary T cell differentiation following ultrafine particle exposure. Again, trying to gain some insight of what could we do for moms that are exposed potentially ubiquitously in their environment to look at specific diets that would be rich in antioxidants to help protect against that immune dysregulation. I also had another graduate student that looked more at the early outcomes. And so in a study, when we looked at what was happening kind of after that immediate exposure window, we saw in our model that ultrafine particles could actually decrease the overall placental weights, restrict fetal growth, and also alter the vasculature within the placenta, mimicking many of the things that have been observed in human cohort studies. Also, again, the loss of that important maternal antioxidant response through the NRF2 factor significantly exacerbated the effects. And we looked here, this is just to show we did a lot of sequencing of the placentas, looking at maternal circulating blood as well. And I'll just highlight sort of the worst case thing that we saw continue to pop up. And these little kind of candy cane bars here showing a high dose of ultrafine particles in a mouse that cannot mount an antioxidant response. They had the most skewed phenotypes, meaning that they had the most effect on the birth weight. This tended to be the strongest in the female offspring, so there may be some sex-based differences there. And we saw for some of these markers related to lipid transport, the ApoA1 and ApoB markers were significantly increased. And this just gives some insight for maybe continuing to look at how those could be potential biomarkers associated with risk for adverse effects early in life. So to answer some of our questions, We think that it's not only the fine particles, but also ultrafine particles that play a role in increasing the risk for childhood asthma development or onset. And we believe that it's likely a combination of both of these mechanisms, including indirect, so that maternal inflammation and kind of oxidative burden, and then also potentially the direct effects from ultrafine particles directly altering that fetal immune cell differentiation. Now, I also want to transition to kind of our second case study is talking about VOCs. So we know we're not just exposed to one thing in a vacuum, and often when you have particle pollution, you're also going to have VOCs present. And we really wanted to kind of move into beginning to answer the question, how does exposure to these more complex mixtures actually cause asthma? And kind of starting just thinking about the BTEX compounds as those low molecular weight, very ubiquitous exposures in the environment. And it's not only outdoor, often there could be indoor sources as well. We know, though, that VOCs can be elevated in fence line communities and following disaster events. So our group really started to get interested in doing field-based campaigns and mobile air monitoring, following what many of you in this room are familiar with, the millions of pounds of VOCs that were released after Hurricane Harvey, reports after the ITC fires, and then also kind of smaller scale yet important in residential neighborhoods. There was a plant fire in Channelview where regulators and residents were really questioning, what all was in that mixture following that acute kind of disaster event. So again, I had some great graduate students begin to develop the new aims within this project. First, through mobile air monitoring, could we determine kind of where VOC hotspots may be occurring? So there's a lot of value in these robust stationary air monitoring networks to give you that highly resolved temporal kind of resolution. So looking at daily, looking at annual averages. But what about high spatial resolution through mobile air monitoring to get a better idea of where there could be potentially some of these BTEX hotspots using targeted approaches? We also wanted to get an idea of what some of the complexities of these mixtures may look like. So using non-targeted analysis, basically any molecular weight that's going through our mass spec, could we get an idea of what may be present in the ambient air masses? And then last, could we apply this to a disaster event so we could help uncover kind of where hotspots may be and what may be present? And so we developed what we call the Mobile Responding to Air Pollution in Disasters van. On board, we have a proton transfer reaction, time of flight mass spectrometer, which is basically a super fancy breathalyzer, super expensive, where as air flows through the tube, it is being picked up at a second resolution for that specific mass. And we can go into our library and we can say, what could that potential compound be? We can link that with location information through GPS. And here's an example of the type of data that we could get as you're driving around. You actually could drive by a gas station, pick up a little bit of benzene potentially, and then see that go down. And these are some data. We actually did go out with the TCEQ Smart Van, do some internal validation studies, seeing, when they're seeing levels go up, are we seeing levels go up as well? This is our kind of general workflow for the data, because you do end up with thousands and thousands of data points. So we're collecting the data, we're cleaning it, we're analyzing it, and if we have the calibration standards, that's what we're calling the targeted analysis, because we can do the absolute quantification. Often, and I'll show an example of what we've done in some of the work in Channelview from last summer. We also have gone on to do some non-targeted analysis, again, looking at what the potential compound names may be based on the molecular mass. And then in cases, which I don't have as much time to probably go through today, we have applied this in some of the disaster response, including the derailment in East Palestine, a plastics fire in Indiana, and more recently, a tire fire in Jackson, Mississippi. We visualize these data. Our ultimate goal as academic research is to publish this data, but also if we're ever working in communities, we also are doing report backs, working often with regulators or with local community organizations to report these results back to people living in these communities. All right, so here's some data from Channel View. And I should mention this was part of a pilot project funded through Houston Methodist to look at BTEX in sort of ship channel and adjacent areas. And the goal was to quantify and map BTEX concentrations at a high spatial resolution to identify hotspots. So this was strategically designed to go by 2 of those TCEQ auto GC locations. So we could also see, how does the stationary air monitoring data compare with the mobile air monitoring data? Typically what we'll do is we'll drive this route 2 to 3 times per day. We'll start in the morning with a kind of background location. For this study, we actually drove around University of Houston campus for sort of an urban background. In the morning, we do morning and afternoon runs within the target area, and then again, we do a background in the evening as well. So you could see as levels change over the day, you could also make those sorts of comparisons. And here's just sort of a high-level picture of the types of maps that we were able to create. These data have been reported back to the community, and we are now going through the process, and this publication is under review. You can see this is the wind rose plots. So here, this is actually showing wind that would be coming out of the southeast direction, so sort of coming off of this area of the water right here. And this is actually shown for each one of the days. So this might have been the first day of the week. We were seeing, high levels of benzene hotspots kind of along this Lakeway Drive. And you can't really see the units, I apologize, but the largest circle is actually anything that's over 180 parts per billion, because that's the Texas-based guideline. Again, that is a 1-hour guideline. And here, it is important to note that often these are second and minute level increases. But generally, that's when we would typically see kind of the high levels of benzene. We didn't see as much on these 2 days, but we did a little bit more on the 4th day of this campaign. Often we would see overlap for toluene, which is shown in green, but sometimes we would also see some unique signatures and unique areas. Same thing for mixed xylenes, which includes ethyl benzene. I've got about 5 more minutes, so I'll walk you through one more example of some of the work that we've been doing in Dallas. And this was funded through Robert Wood Johnson Foundation. And so a shout out to Dr. Ziara Favright, who's now graduated and working here in Harris County. She had been leading 2 community-based participatory research projects in 2 fence line communities in the Dallas area. One, which is named Joppy, or also pronounced Joppa, which is in South Dallas. And there are actually a large rail yard and a variety of industrial point sources next to this neighborhood. It is a historic freedmen's town. And then also working in the Singleton Corridor, which is in West Dallas, where there is a large industrial footprint and again, rail yard. So kind of the frameworks for doing the surveys in these communities of potential health effects have been published, and asthma is one of their main concerns, and there are very high prevalence rates of asthma. So Dr. Eva Vitucci, a postdoc in my lab, kind of carried out this mobile air monitoring in this area, and we did it actually over 3 different years, over 3 different seasons. So this is showing that data. It's also in the second round of revision and should be published soon. We made comparisons in this case with the background in Highland Park, and just the short story, we saw that there were many more kind of total VOC hotspots using the non-targeted approach and kind of using more of this Z-score, looking at total amounts of VOCs that are present in these fence line communities. We saw that the fence line communities had more locations where multiple VOCs were directly elevated in these hotspots, supporting kind of increased and continued VOC monitoring more locally in these neighborhoods. And again, we've also had the opportunity to respond to several disasters. Some of these papers are published, some are continuing to come out. And what we're doing here is we're really trying to compare the distinct VOC signatures across different types of environments. So we're currently making comparisons between kind of plastics fire, chemical fire, and tire fire. So we can look at what are some of those VOCs that may be specifically elevated during those times. And then we're still answering the question, how do these exposures cause asthma? We don't know yet, since they aren't as routinely measured. I mean, they are routinely measured, but there aren't as many observational studies that have been able to discriminate that link. It would be infeasible for us to do all this back in the animal model. So our lab has really tried to decrease our reliance on rodent models and using human bronchial epithelial cells. We've mimicked some of the mixtures that we've observed in neighborhoods. We've exposed our cells at an air-liquid interface, and we have started to see that some of those initial adverse outcomes on the kind of pathway to asthma are elevated, including cytotoxicity, barrier permeability, oxidative stress, and those same pro-inflammatory cytokines. So last couple of slides, kind of big picture, since this was a public health related talk, and I look forward to interacting with many of the people here that are really focused on solutions. What our framework really is looking at how we can get our data from the laboratory to the community towards that public health action, trying to fill some gaps with dose response and potential biomarker discovery, as well as exposure assessment to help inform improved policies that could be federal, state, or even hyper-local. And then also kind of related to biomarkers, looking at ways to personalize environmental health. So I'll acknowledge all of the past and current lab members. A special shout out to Dr. Yang Yuok, who's now here with Air Alliance Houston. I didn't have time to talk about, she did a lot of work with personal air monitoring, again at high spatial resolution. Our funding from NIEHS and Robert Wood Johnson Foundation, and all of the team that's worked to make this possible. My email's there. If we don't get a chance to chat today, don't hesitate to reach out. Thanks so much.
All right, we have plenty of time. If there's anyone that has any questions, please stand up and ask.
I'm Xuan from Baylor. It's a great work. Thank you so much. I have two questions, one related to the mechanism, another one related to exposure assessment. So in your studies doing biomarker and mechanism analysis with different type of pollutants, did you notice that the mechanisms are different by pollutant type? Because based on my reading on literature, like most mechanisms around inflammation, oxidative stress, I was just want to hear your comments about whether there are different pathway or mechanism for different pollutants. Another question about exposure assessment is, you mentioned that your VOC mobile sampling project, one goal is to compare with the EPA monitors.
Mm-hmm.
Did you find a similar or difference during the comparison? Can you share some results? And also for VOCs, I feel like the species, like the quantification, are the methods pretty established. What is the advantage of using non-target for the VOC sampling?
Great question. So I'll answer the second one first. I didn't put that slide on there, but we actually did see a really good concordance between the mobile air monitoring data and the stationary air monitoring data. Typically, we had a little bit higher levels, which I think reflects that we were encompassing a larger area, and that's what would be expected. But we were glad that we saw the general trends were tightly correlated. As far as the methods being established, the non-targeted is a somewhat novel method. There are some limitations, as that you wouldn't know, for instance, if you had a specific mass, it could be 5, 6, 7, 8, or 9 potential different compounds. But if you were consistently detecting that, you could go back, get the standards, or use an auto-GC to then kind of further discover what may be present. And that could be really important because there's a lot of chemistry that's happening in the air, especially during fires, that could create, potentially toxic compounds. What we've been doing with that limitation, we're still putting all those formulas into EPA CompTox dashboard to get an idea, if these chemicals were potentially present, what would the health effects be? And for all of those different disasters, what we're seeing is the highest risk would be acute inhalation hazard, as you would expect, acute dermal, and eye irritation. So things that residents are also reporting, which kind of helps us feel like, yes, we're probably picking up something that's actually going on. What we do see is a lot of data is missing, which is why we want to use that to go back into the in vitro model for the screening. So to get back at your first question, do we see different mechanisms based on different pollutants? So unfortunately, in our mouse model, which was really designed to be more mechanistic, we only looked at one pollutant mixture, and that was the ultrafine mixture that we generated to be sort of a representative ambient particulate matter. So we didn't go through and screen different PM sources. For our VOCs in vitro, we are able to do single pollutants and then combine them as mixtures, and we definitely are seeing different mechanisms. Acrolein and formic acid, that is definitely showing acute airway irritation versus something like benzene that isn't really acutely toxic to the lung but can cause oxidative stress and DNA damage. So we're hoping to answer some of those questions using higher throughput technologies like in vitro screening.
Thank you so much.
I was wondering how you distinguish between whether the effect is coming from the number of ultrafine particles or from the mass of PM 2.5. I think one of the slides you showed early on showed that often the highest number of ultrafine particles is actually when the lowest PM 2.5 is around with some of the new particle formation events. And so I was wondering how you distinguished it in your laboratory studies, like maintaining it as being ultrafine particles at 100 micrograms for 6 hours that they didn't condense or coagulate, and how in a bigger picture policymakers should know whether what's important is to reduce the number of ultrafines or the mass of PM 2.5.
That's a great question, and we probably should start expressing our y-axis as particle number. We had a harder time, so we actually, the data that we showed originally, we ended up calling our lower dose, and then we did a higher dose, and we did struggle with getting higher mass concentrations because you would start to get growth. But still, we could show it as that. It does show a dose response. The higher number of particles, we were seeing a greater effect. So that's probably a better way to express it versus the mass concentration, and a good way for us to start thinking about it.
Hi. First, I want to thank you for your work that you've done in Channelview and for your outreach to the community. We are the mice. We validate your studies because we do have a high number of childhood asthma and respiratory issues. That also expands into our older population also, and into our pets. I have 3 dogs. They all cough a lot, not normal. But I do find interesting your discussion on the ultrafine particles, black carbon as you called it. I have recently acquired a white vehicle, and me and my husband have been discussing that every time there's a heavy dew, light rain, or I go to spray off my car, although my car looks white, when it gets a little bit of water on it, I get black runs. So we've been referring to it as soot. So I don't know. I know y'all have done other monitorings in our neighborhood. I don't know if you monitored for the ultrafine particles in there. So that's basically my question on that. And like I said, I find it highly interesting that that's what we've been noticing in there. And I don't know if it's from the flaring or where they're coming from, but we do have that issue going on.
Well, thank you so much for your question and your collaboration, because community is what really informs the science and can drive some of the relevant questions that need to be answered for folks living on the front lines. To answer your question, my lab has not done any mobile monitoring of particles. We have others, and I think Grace will show some examples of other groups that have been doing mobile PM monitoring. And one of my colleagues at A&M actually has done some of this work, so there's potential to do some of that level of monitoring and even start to look at the ultrafines. And we also have done some studies actually in the past in Dallas where we've looked at things like car wipes, soil, to dig deeper at the chemical constituents and look at what might be present in that to give an idea of the fingerprint. Where we are now is everything is regulated by mass still. So in the science, though, we know that not all mass is equally toxic. So it is important to get an idea of what chemicals may be present, if it is soot, if it is black carbon, if it has a high content of polycyclic aromatic hydrocarbons. So I look forward to more discussion, more science, and I really appreciate your insight.
Okay, well, thank you for all your help.
Howdy. So I'm not sure what your experience is with instrumentation, but I'm curious what you could say. How are we to understand the difference between the mobile monitoring, the regulatory monitors? You mentioned that they were tightly correlated in your one study, but even down to the low-cost sensors. Like, could you just explain the gamut of instrumentation?
Sure, and I'm no engineer, so I think Dr. Flowers can also expand on this later. The regulatory grade monitors, have a function, helping to look at what's in attainment. So that's what has the strictest QA, QC. That is what is used to determine compliance. And it has a high level of temporal resolution. So really important in showing what's happening over long periods of time to look at things like the trends over the decades. Lower cost sensors also can play a vital role, in my opinion, in that they're cheaper. They can be deployed at a higher spatial resolution across neighborhoods. Again, I think Grace will probably comment on some of this work that they've been doing. To get an idea, again, what are some of those local hotspots in an area that we couldn't drive all the time? I think where some of the mobile measurements can fit in, again, looking very hyper-local at distinct hotspots and the power of discovery. Again, as an academic, we have the luxury of saying we're here to do research and see what maybe needs to be looked into further. So that's why we really value our relationships with community groups and with regulators as well, especially in disaster events, to work quickly to see what might, you don't know, one, during a disaster, if the air monitors are going to be operating. They may need to be shuttered to be protected. They may not be located in an area where a disaster hits. So since there's that high level of uncertainty, mobile allows additional capacity. And that's why there also has been mobile monitoring by TCEQ, by other research groups to help fill some of the gaps of the unknowns that can then be looked at further, and eventually with other public health experts and epidemiologists, look at those linkages with human health effects. Hopefully that answers the question.
All right, everyone, thank you.
Thank you so much.
Thank you, Dr. Johnson. Very interesting presentation.